everybody. My name is Frances Castnetta-Dice, President of the Houston East End Chamber of Commerce, and it's an honor to welcome you to our COVID-19 business webinar. Today is Tuesday, July 7th, and we're doing this via Zoom. And we're very honored to have three experts to talk about what's happening right now. This business webinar will showcase strategies to help you survive and thrive with the new regulations regarding face coverings and social distancing. You're going to learn how to manage the science behind wearing the mask, show social distancing, and being safe in a public space. Hear about new legislation and state approvals that increase new and existing opportunities for restaurants and grocery stores. We're very honored today. We have three experts. We're going to first hear from Dr. Ruth Bush of the University of Houston College of Medicine, and her bio is on this page, but we're going to go straight to the discussion so that you can hear from them. And then we're going to hear from Melissa Stewart from the Greater Houston Restaurant Association. And then lastly, we're going to hear from Kelsey, Erickson, Streufert from the Texas Restaurant Association. So sit back, take notes, and this will be recorded. So in case you or other coworkers, we want to share this with anybody, we'll have this on our website. So thank you all ladies for joining us today. And it's very inspiring to have three ladies talk about this topic today. So thank you very, very much for joining us. But now we're going to hear Dr. Bush. Would you mind go ahead and starting with your presentation?
Sure. Thank you very much. And I'm very honored to be here. I appreciate this opportunity. Let's see. So I have a few disclosures to make. As she said, I'm Dr. Ruth Bush. I am a surgeon by training. And so my disclosures, I have worn a mask in my job for the past 30 years. I have to say that I was first a mask snob when the regulations started coming out about 4 months ago, but my understanding around what is appropriate, what is safe, and expectations of myself and other people have changed over those 4 months. My number one concern really is to my family, but it's also to the vulnerable veteran patient population that I take care of. So I don't want to infect myself or others, but I really don't want to take anything back to my clinic or back to the hospital that then I could infect some of my patients. I will disclose that I love eating out. I have not eaten in a restaurant since the beginning of March. I miss it desperately. My husband and I met on a blind date at a restaurant in Houston. We love going and having a glass of wine, and I want to be out and about, and I want to do that safely. So I get the joyous job of sharing Biology 101 with everyone and giving you a science lesson. So I want to talk about SARS-CoV-2, which is the virus, and then COVID-19, which is the disease it causes. So if you think about this similar to HIV and AIDS, HIV, human immunodeficiency virus, is the virus, and the disease it causes is AIDS. So this is similar, and this is why you will see the language different in some of the literature and in the news reports. It is a single-stranded RNA virus, and in addition to the sudden and short-lived outbreak, many of you might remember from 2003 of SARS, there are currently seven coronaviruses that we know of that infect humans and that cause disease. 3 of these cause the common cold, and one of the coronaviruses is responsible for 2 to 5% of cases of the cough that occurs in children ages 3 months to 5 years. It is called COVID-19 because it was discovered and came about at the end of 2019. So that's why it is COVID-19. There are not 18, but 7 human coronaviruses total. The biological properties of coronaviruses are that they are much less severe in young children. We've seen that with the SARS-CoV-2. Getting it as a child may offer some protection against reinfection later in life. That's been seen with some of the other coronaviruses, and it's to be determined. We have seen in young children with this coronavirus that there's a decrease in the overall infectiousness in children and a decrease in the severity. We do hear about horrible reports in the news, but overall it has been more severe in an older population. coughing and droplets from the mouth are the major way it's spread. It does replicate deep in the lungs, and I'll talk about the replication in just a moment. It does replicate in the upper airway and nasal passages. The fact that SARS-CoV-2 primarily targets the lower respiratory tract also contributes to the severity of the lung damage that you've seen in the news. The lung tissue is very fragile. The alveoli are these thin-walled sacs where the gas exchange occurs in your lungs, where oxygen transfers into the bloodstream. So you can imagine those little sacs filling up with fluid. People become very short of breath. They have the respiratory issues. They need oxygen when they go to the hospital. That's part of the why you've also seen false negatives occurring with the nasal swab test that we offer right now. Someone who has the SARS-CoV-2 deep in their lungs may not have coughed up enough virus to be detected via a swab. If they do test later, their results can flip to positive. But for large-scale screening, we have found that nose and throat swabs are still the best strategy. Sampling deep in the lungs is too invasive. So the flu and coronaviruses infect new cells by bundling their genetic material into what's called a virion, or a virus particle. Flu is a little bit different in that it packages proteins that have enzymes to facilitate the entry into their target cells. Coronaviruses, however, don't need to add enzymes to their particles because they co-opt, or basically hijack, the host cells, so your cells' enzymes, to make their way into cells. But the enzymes lose activity. Flu viruses, by the fact that they had their own enzymes, have a limited shelf life. So we haven't seen that with coronaviruses. They extend their time that they stay infectious outside the body because they don't need their own enzymes. We've all seen the news broadcasts, and even on the front page for this webinar, the basically pandemic logo of the gray styrofoam ball that's dotted with these red spikes. They look like cloves to me. We've seen those spikes as they appear. They ring the body of this virus, the styrofoam ball, like jewels in a crown, which is the name of this microbial family, coronavirus, or crown. So biologically speaking, those spikes, those jewels in the crown, are critically important. They are literally the point of contact with our own very fragile lung cells. So it's similar to having a key made for a specific lock. The spikes will fit in with the receptor that is on cells of the air sacs, the alveoli. Once that connection has been made, it allows that entire ball, if you will, to slip into the cell, and then it starts replicating very, very rapidly and making thousands of copies. The spike is very stable compared to other proteins, which makes it less of a moving target for antibodies or drugs designed to block it. But being stable also means that it increases the chance that we can make a vaccine that is targeted to that specific spike protein. So how do viruses spread? We know from other viruses, the measles, the flu, that they spread by close-up person-to-person interactions for extended periods of time. Briefly passing someone in a hallway, you're probably not going to get enough inoculum of virus to be able to be infected. But again, it's close-up, person-person interactions. This virus is transferred via mucous membrane, so eyes, nose, mouth. Not through the skin, not through osmosis, not through our pores. It's mucous membranes. So crowded events, poorly ventilated areas, places where people are talking loudly, yelling at each other in each other's space, or singing. And what we're talking about is breath going out, droplets going out, and being able to extend further. So I spoke a bit about infection and coronavirus, but this slide really shows the direct and indirect methods of getting the coronavirus, how it's transmitted, how you or someone you know could get infected. So we know that the droplets come from your mouth or your nose when you sneeze or cough, talk loudly, sing, and they can spread up in the air for up to 6 feet. Why is the 6 foot a magical number? Not really. What we know is that when we talk or when we yell, droplets come out of our mouth. You know, we've all been in a situation where, you know, I've been talking really loud and I've spit in somebody's face. The bigger droplets will fall to the ground. The heavier droplets will fall. It's the lighter droplets that may remain in the air. But when they drop, they could land on some object or surface. Someone else comes along, they touch those surfaces, then they touch their eyes, their nose, or their mouth. And that's how they will get indirect exposure to the virus. On the other hand, by direct exposure, people are coughing, they're sneezing, they're talking. The particles are in the air, someone else inhales them in directly into their respiratory system, into their lungs, possibly causing infection. So from this, we know we need to stay 6 feet apart. The ability for the droplets to remain in the air decreases dramatically after 6 feet. You'll see reports saying, oh, it goes out to 12 feet, it goes out to whatever, but the percent that is available becomes much less after that 6 foot mark. We also know we need to avoid touching surfaces, but if you do touch a surface, just make sure you wash your hands. You carry your hand wipes. You wipe all surfaces you have touched. I do encourage people to try not to wear gloves. I know that may be counter to what you've seen some people doing, but I have found that people who wear gloves tend to touch more things. If you watch somebody with gloves on, say in the grocery store, they tend to touch more things and then contaminate, touch their purse, touch their mask, touch other items, and so then they can cross-contaminate. I think it's different for healthcare workers, it's different for service workers inside a restaurant, but I think for the general public at large is what I've advised, is unless you're used to wearing gloves and used to keeping your hands away from things, that we don't do that. We just be very careful about good hand hygiene. We've also heard a lot about social distancing. I don't know who came up with this term, because there's nothing to me social about distancing, but it really does prevent the spread of any type of virus. So if you look at this picture, you can see that the person in the center at day 1 is infected. If they do no social distancing, a lot of people in 30 days can become infected. So how does that happen? They infect one person, that one person goes off and infects 3 people, and those people each infect more, so it's really exponential. So without the social distancing, much more spread. However, we know that there's 75% reduction in viral spread with social distancing, staying 6 feet apart. So if we look at the same number of days, 30 days later, only 2.5 persons would be infected. So this really prevents the infection, flattens the curve. We're not going to make the infections go away. That's not what we're trying to do. We're not going to make coronavirus disappear. Really what we're doing with the masks, with the social distancing, is allowing our healthcare system to catch up. We need to let the doctors, the nurses, the first responders catch up, take care of the patients, so that we don't have the 406. We only have the 2.5 at a time. So I think these effects are real. The science has proven to be real, and this will help the spread in our communities. Just a little bit of data is we've heard about asymptomatic spread, so we can be carriers, and that's in 40 to 45% of cases by this study that was just published in the New England Journal of Medicine. So basically a flip of the coin if I've been exposed, whether or not I'm going to be an asymptomatic carrier. So I want to be careful. I don't want to carry it back to my husband, who actually does have a chronic disease, or my patients who have a lot of chronic diseases. If you look at this laser or this fluorescent image in the bottom right, this is someone spewing droplets while talking with and without just a paper towel over their face. So you can see a lot of droplets will form, and that's just part of taking a breath, and that's part of talking and breathing. But if you can cover that, it will be much less. And this is where my my expectations and my mask snobbery have changed quite a bit as we have gone on with this pandemic. There's really hasn't been really any specific guidelines on what the most effective materials and designs for face masks. We really, at the very beginning, wanted to protect our personal protective equipment, or PPE, surgical masks, N95s for our healthcare workers. The supply chains were very limited when we first went into our lockdown, if you will, in March. The PPE chains are much better now. While there have been studies on medical grade masks and how they perform, the data on the cloth-based masks was pretty sparse. This is some research from the Florida Atlantic University College of Engineering. They used flow lab and laser lights to make synthetic respiratory droplets. They mixed distilled water and glycerin, and then used a mannequin to simulate coughing and sneezing with different mask scenarios. So they tested masks that we might use, non-healthcare grade. So they used single layer bandana style mask. That's the one up on the top. And then the one on the bottom is a 2-layered cotton mask of 70 threads per inch thread count. So with the folded cotton bandana, the droplets will travel for 1 foot 3 inches. But with the stitched cotton mask below, which you can easily buy, the droplets only travel 2.5 inches, so much less. So we're really staying within that range if we're going to be up close with someone else. The results from this study also showed that loosely folded face masks, bandana style, provide minimal stopping capability for the smallest respiratory droplets. However, the multi-layers, at least 2 layers, perhaps putting a filter in, and I tell people you can cut filters out of a coffee filter, you can cut filters out of a vacuum cleaner bag, nothing with plastic, something that you can breathe through, but these will really curtail the speed and range of the respiratory droplets that are spewed out. There's always going to be some leakage from around the sides, there's going to be some leakage from above, but we don't want it going forward to people. How does this translate into safe restauranting? And I don't think that's a word. And I'm going to let the experts speak about that. All I can speak from is with social distancing, with masks, is that we've really got to think about spacing the tables and the stools, limiting the party sizes, and people have to be smart, not just the restaurants, but I think we all as a society have to take responsibility for this as well. My brother and sister both work in service professions and have been hit pretty hard by this because of the closing down and then opening very slowly. I think you all, as restaurant and business owners, it's an extra burden that you have to shoulder to having safe strategies, keeping your employees safe, keeping the people that then they go home and come in contact with safe. So I'm not going to preach definitely to this crowd. These are just some thoughts that I had as we are trying to figure out how to open up our new College of Medicine to our inaugural class in 2 weeks is directing flows, minimizing contact, minimizing persons in different spaces. And so these are just some ideas. And I will end here as I think that the social distancing and mask, while some of this has become politicized, these are really public health measures. This is not about politics. It's really just about public health. These are simple yet effective practices. What they do is they allow the science to catch up. I love Matthew McConaughey, who said, wearing masks, and I'm going to add social distancing, buys us all time. It buys our science time. It buys our hospitals time. It allows the hospitals to empty. It allows the healthcare workers to get some rest. It allows these brilliant researchers to develop treatments and a vaccine, and hopefully allows our businesses to continue. And so I will end there, but I thank you for your time and for letting me talk basic biology.
Thank you. So we've heard the science behind this, and we're so grateful to that, because some people are getting lax, and I think it's just a good reminder to how important it is to be safe out there, not just for yourself, but for others. But we have a couple of questions before we bring on our next speaker. And the first one is, families tend to feel like it is okay to be together. How should families manage social distancing?
So a couple of thoughts on that. I think it has changed over the 4 months. So, I know that my husband and I, we were in the lockdown for several weeks. We did not interact with other people, but his mother also, my husband's mother is in Beaumont. We made sure that she stayed at home as well, and we arranged for food to be delivered to her. So we knew that any interaction she had had before that had not occurred. Also, he and I had not had any interaction. So we know that people can transmit and be infectious for up to 14 days, and after 14 days, that goes away. So what he has since visited her to make sure she's okay, because we know that we've both been in isolation. So I think families that, live together, definitely you all know who you've been around. I think it's very important to have those family interactions. And I think people have become very isolated. I think we're also seeing some of the mental health effects of isolation. So my advice is that if you haven't been around anyone, or your loved one or your grandparents have not been around anyone, then I think it is safe to interact with that 2-week window. Now, if my mother, for example, I know she's escaping and she's going to the grocery store. She won't tell me, but I know she's doing it. We tried to keep her in. We are limiting who comes in contact with her. So I honestly have not seen her, because I don't want to take anything back and forth to her or to my patients. But I think families, if you're concerned about any exposure, say those of folks who have to go to work, or are healthcare workers, or going into businesses, I've seen pictures of people having a 4th of July picnic. You're maintaining your 6 foot. Put the food on another table. Cross-contamination and getting coronavirus from food has not been proven. It's a respiratory virus. So I think if your food is prepared safely, similar to at a restaurant, and it's delivered, you can be together. I think we do have to think about the burden on families mentally for not being together as well. And just make sure that if you've been out, admit it to one another. Admit it if some teenage kid or 22-year-old has gone to a bar, and just be protective.
Thank you. That's a very, very good answer. And this is the last question before we go on the next one. But if someone doesn't feel comfortable going somewhere, what is the best gracious way to decline an invitation?
Oh, I think we're beyond that. I just tell them I'm not comfortable. And I was talking about this earlier today. As a surgeon, I'm very used to protecting my patient that's under anesthesia. Back away from the table. Go put on a mask. Don't come any closer than this. Don't touch that. I think we've got to protect our loved ones, and it's about saying we're in the middle of a pandemic, and I think nobody's been isolated. Everyone has seen the news or heard something, and I think I want to protect my family, and that should be gracious enough. I would hate that someone doesn't understand that. And the last thing I'm going to show you is I love to accessorize. So I have found every mask known to mankind of different, and this is my favorite one for University of Houston. It has bling. I don't know if you can see that, but it does have bling. So
where did you get your mask?
If I've got to wear a mask, I'm going to wear cute ones.
It's beautiful. Thank you for sharing that. So now it's my honor to introduce you to Melissa Stewart with the Greater Houston Restaurant Association. And she is going to just discuss her thoughts on what's going on during COVID-19. So Melissa, thank you so much for being here.
Thank you so much for having me. I have to tell you, I'm a bit of a fangirl for the East End. My husband and I actually got married at the Magnolia Park YWCA over on Navigation. I had served for many years on the board there, and in fact, our first home was in Idlewood. So, as I'm a Northwest Houston girl, born and back, but man, the East End, it's very special to my heart. I love that community so very, very much, and was truly honored to get to work with y'all today. As y'all
And
saw
I love your background. You have Gonzo, Houston, his
I love
art.
Gonzo. He is, and he's such a nice man. My goodness, we could not have a better ambassador.
I agree. Mm-hmm.
So my name is Melissa Stewart. I'm the executive director for the Greater Houston Restaurant Association, and we're a chapter completely within the State Restaurant Association. I'm very fortunate that my cohort, Kelsey, is going to come on right after me, and she is our Vice President of Government Affairs and Advocacy, and so she's going to be much more statistical and really talking about some of our policies and things that we've done from a very formal way. But I'm just going to talk a little bit about our industry and just, I guess, some of my Houston pride. I'm born and raised here. And so I just want to talk a little bit about the industry, the state of the industry, and a couple of good tips for folks who are listening. So we should know, hopefully, that we are the most diverse city in America. And the great thing about that, aside from just all the culture that comes, is that's how we get our great food. When you have only one kind of people, you only get one kind of food. You get everybody, we have all the great foods. And I am very, very, very spoiled. And when I travel, my comfort foods tend to be queso and chips or spring rolls. And spring rolls being one, especially on a weird days. And I remember a trip to Chicago, and not that they don't have spring rolls in Chicago, I'm sure they do. But in Houston, I'm never more than 2 miles from spring rolls. And they weren't 2 miles from where I was in Chicago. So I was very, very sad about that. Restaurant industry and the hospitality industry is one of the top 4 industries in Houston. It kind of goes up and down. In fact, the restaurant industry and everybody who has contributed to it has really put Houston on the map. Forever, we were just known as oil and gas, and we rode horses to work, and we didn't do that, but people think that. But now we are a major convention draw, and it has everything to do with our restaurants. We know we are great when you get here. We have tremendous people. Yes, it's hot outside, but we know how to air condition the inside, all those good things. But the restaurants, that is the cornerstone of any community, and we're so blessed here in Houston. Restaurants are where you get proposed to, you meet your first love. It's where you celebrate anniversaries and graduations, and we will again. This is just temporary. So we don't want restaurants to go away. Here in Houston, if we took a snapshot on February 1st, we would have seen about 12,500 restaurant independent units. We were employing well over 300,000 people. It was a major economic engine throughout our entire wide community. Unfortunately, on March 24th, when we shut down dining rooms, what we knew is almost immediately 10% were never going to open again. And that's for a lot of reasons. But one of the big ones is restaurants have always been a very thin margin industry. We operate with about 2 weeks of operating cash. We take a lot of people and a lot of materials to produce what we produce. So if you're dining out and on your plate, for every dollar that you're spending for that plate of food, at minimum 95 cents are going directly into your dining experience. The food, the building, the preparers, all that. So very, very thin margins. But that's okay. This is not a new thing for our industry. So unfortunately, what we also know, and Kelsey will get a little bit more into this, is depending on how long this goes on, what additional help we are or are not able to get, by the end of the year, we could lose anywhere from 20 to 30% of our industry. And that's just, it's devastating. But for restaurants in particular, this has been really a different kind of challenge for us here in Houston, I guess, because we went through Harvey. We know we are Houston strong. We know how to make it. The difference is when you have Harvey or Imelda or any of those other ones, what you see is water retreating. So it's a matter of, oh, can I make it 10 days? we're going to be on the other side of this in this many days. We can't see COVID. And so I think that has made it really difficult for us, because a lot of our earnestness and stick to it and make it through doesn't apply to this crisis. And so we're having to learn different crisis adaptions. And that's been a really hard thing. You know, after Harvey, one of the amazing things was talking with the SBA, because they were saying, hey, we have all this money, nobody's asking for it, because every time we talk to them, their answer is, oh, somebody else needs it more. And so as Houstonians, we were just like, nope, we're going to grit through it, we'll make it work. We don't need to do that. Ask for help. By being on this webinar, watching this conversation, you've already started the process. Look to the trade associations, the chambers, the government groups. There is help out there, and you need to ask for it. This is going to go on has already gone on for quite a while. We're going to be seeing the effects for a while. Don't think that you are tough enough to stand up on your own. Ask for help. Seek out that help. It's complicated, and you know, that's one of the challenges, is all of our small business owners have had to all of a sudden to become legislative interpreters. But the help is there, and you can get it. I'll close with just a couple of quick things. It's just, restaurants are always changing. When I was a little bitty girl, and I'm not telling y'all how many years back that is, because it was a lot, but we had a Shipley's Donut at the end of our block. And I was like 2 houses in. And one of my most vivid memories is walking over there on a weekend morning in my house coat, probably wearing slippers, with my dollar to go get my bag of donut holes. And it's just one of those first early memories in that restaurant in our city. And that, since that time, that space has changed so many times. Admittedly, now it's a liquor store, which would be somewhere I might still visit as an adult. That might be my new favorite thing. But the restaurant industry isn't stagnant. We don't stay the same. So change is inevitable. This pandemic has really kicked the door on that for some things. And I just want to take 2 quick seconds before we get to Kelsey and just talk about some of the amazing innovations that have come out of this. It's not enough. We need a lot more, but these are some awesome things that happen. We were able to get alcohol to go and mixed drinks to go from a restaurant to take to your home safely passed. We hadn't even ever thought that we could get that 100% taken care of directly from the restaurant. This is a major revenue source for restaurants. It's a great thing for folks who, I love my chips and queso, I love my fajitas, I'd be happy to take it home, but I want my margarita. Well, now you can have it all. Bring it all home, then you're not driving on the streets, you're safe. It's a great thing, and it's great for the restaurants, because the challenge would be is if you were taking it to go, that profit center of alcohol was going with you. So now we can make it all work together. We have the food waiver, so a lot of our restaurants have now got their food in the grocery store, so that you can go into a Kroger or an H-E-B and take home Chef Hugo's great food, or the turtle soup from Brennan's. Those are things that are now widely available to the whole city. We didn't have that before, and we're taking a lot outside of a pandemic crisis to make those things happen. We have groceries at restaurants. How cool is it to get your to-go order and your bread and milk for the week? We love that innovation. It's been great for our small farmers. Some of the family meals I'm seeing, Brennan's did a couple of different ones that were just amazing. I get several offers every day. I don't get to take advantage of them all, but a Boozy does this really cool thing. Well, they'll come to your house, shuck a dozen oysters, and give you a bottle of Veuve Clicquot. I'm like, oh my gosh, how cool is that? But I would have never thought to do that really innovative thing had we not been in this crisis. Online ordering has exponentially taken care of things. We are even better at, restaurants have always had great sanitation. We have certifications in sanitation. We are all the better for it now. So we're taking care of so many really cool things. And I'm very, very proud of everything we're doing. The last thing I want to say, though, is you can help us. If you have a restaurant you love, make sure they know you love them by eating there, take us to your table. You don't need to eat inside if that's not your comfort level. Totally understand. We have limited capacity. Bring it home. If you want to order from somewhere, please, please, please call them directly. if you can go pick it up, pick it up. Third-party delivery systems are very helpful, but they're very expensive for the restaurants. So anything you can do to get that money directly to the restaurants is super appreciated. Tip graciously and as deeply as you can. Our hospitality workers are struggling, of course. And for goodness sake, wear a mask. Let's get out of this. I want us all to be packed in ninfas and spilling over to El Tiempo and just having one big taco fest in the fall, because we are safe and we can do that together. So thank y'all so much. And I'm happy to answer any questions.
Yes. Thank you so much, Melissa. And I love the East End tie. So we'll have to bring you back and show you some of the new things that have happened. But one of the questions we have here is, how do I make my business into a pandemic-proof business? Can you answer that?
No. I mean, I would say that you have to consider a lot of different scenarios, because, in Houston, this pandemic is kicking our bottoms right now. But I can tell you, in 3 weeks, if we have a hurricane, that's going to be all we talk about. And if we can't get oil out of the bottom, that's a problem too. So I think what you want to do is, just like we've done with our city, is you don't want all your eggs in one basket. Can you move and be mobile? So if you've created a menu that can only be fully appreciated dining in, well, how do you get that to be a to-go thing? Or, can you do some limited delivery? What's some creative things? So more ways you can reach your customers, the more ways you can diversify your revenue streams, I think is always a wise business move. And then that helps you be better prepared when we have these kind of crises, so that you have some ways to pivot that you're already prepared for. And
Melissa, the restaurants right now, I know that some of the servers are being either let go and things like that. Do you know of any programs? Because I've heard like Guy Fieri is raising funds for programs like that. Are there programs that the community can help support here locally?
Absolutely. So what we're seeing is multifold. So I would say the National Restaurants Association, Southern Smoke. If you go to the Texas Restaurant Association's webpage, which is txrestaurant.org, and I know it'll be on the splash sheet later, we do point to some of the things for our employees. We would also say that for restaurants, we have our Texas Restaurant Relief Fund, that as we fund money into it, we send it right back out. So we're trying to help our restaurants as well. But just like everything else, if you're in a tough situation, look around. There's a lot of government programs that you've paid for. Take advantage of those. That's why they're there. And I would also say restaurants are hiring. So we know some restaurants, just because of their model, or maybe they have just made the decision to stay permanently closed, there's not a job to go back to. But look around. We have restaurants that are desperate for employees right now. They are actually having to limit their opening because they don't have enough staff.
Great. And for those of you on here in the chat box, Kelsey just added the link to the relief fund. So thank you very much, Kelsey, for that. And then here locally, is there a particular restaurant or two that is that you can, maybe other restaurants can follow their lead of expansion, safe distancing, online ordering, any good ones that we can all follow and thank?
Sure. I'm going to call some people out, and then I'm going to get 50 emails telling me where I was wrong. But two that I think have done a really nice job are Dish Society. It's run by two owners who are just some of the most savvy restaurateurs I've met. They very quickly pivoted to some to-go things, and they did some really clever things, like they added a way for customers to buy meals for first responders, and they had, so that was both giving them the money for the meal and moving on. So Dish Society's one. I also think that Jimmy Chongas and Gringos consistently have such a good culture, and they've really done a nice pivot on this as well, with family meals and the safe distancing and taking PPE and everything very, very seriously. So those are just a couple I would look at, but the innovation is everywhere. Pico's has done a brilliant job. They have an queso emergency kit that is the most clever thing I've ever seen. I mean, just, you don't have to look far. Lots of folks have done some really, really clever things, and I'm really proud of our industry.
Oh, wonderful. Well, thank you so much. And same thing, we're going to have our last speaker, and then we're going to bring you back on and join us collectively. And now it's my honor to welcome Kelsey Erickson Streufert with the Texas Restaurant Association. Thank you so much, Kelsey, for joining us today. There
Hey.
she is. Hello.
Thank you so much for having me.
You're so welcome.
Hi, so my name is Kelsey Erickson Streufert. I'm the Vice President of Government Relations and Advocacy for the Texas Restaurant Association. Thrilled to be here today. Thank you everyone for tuning in. I'm here to talk about a couple of initiatives that we've launched, in particular the Texas Restaurant Promise Certification Program. And you can see at the bottom here, we've partnered with Dallas College, which is the community college district in Dallas, as well as A Closer Look, which is a third-party evaluation company. Think of sort of a secret shopper type model. So before I dive into that though, I do just want to provide a little bit of context, and Melissa did a great job of talking about how this crisis has really impacted Houston. And the numbers that she was sharing are very consistent with what we're seeing across the state. So this is sort of pre-COVID. I think it's really important to recognize that restaurants were 51% of the food dollar in Texas heading into this crisis. So when we talk about, restaurants surviving, it's a huge economic issue. We employ about 1.35 million Texans, pay a ton in taxes to support our state and local governments, but we also feed people. We know we have an issue with food deserts, with food insecurity, with nutrition as a state. And so, the survival of this industry is really critical on so many different factors, as well as I love what Dr. Bush said about mental health and the importance of being together. Restaurants are a huge part of that. So here's sort of a snapshot, and this really is data from April, but it's consistent with what we're still seeing. $4.2 billion in sales lost just by April. Almost 700,000 Texans were laid off or furloughed. So it's been a huge impact. We know nationally that the restaurant and food service industry has lost about 3 times the number of jobs as any other industry. So the impact is huge. We really have quite a deep hole to dig out of. And what Melissa said is exactly right. We can't see the end of this. And that is one of the most difficult things to deal with in this crisis, because you're really having to make decisions based on incomplete information. So that's really where we step in as the Texas Restaurant Association to provide our members and really every restaurant, whether they're a member or not, with the most accurate and up-to-date information possible so that they can focus on running their business. So this whole program really started with the Texas Restaurant Promise. In April, all of our dining rooms across the state were closed. And we knew that in order to get them reopened and to get business coming back, we needed to develop protocols and procedures that would keep people safe and help reestablish trust. So before restaurants were even allowed to reopen by the governor's executive order, TRA really went to work, and we compiled CDC, FDA, EPA best practices, and we put together a task force of restaurant operators of all shapes and sizes, and we said, what do we need to do? What do we need to proactively commit to in order to keep our customers and employees safe? The theme from the beginning was everyone has to do their part. Again, I love Dr. Bush mentioned, it's the restaurant can do a lot to keep people safe, but you have to have that partnership with customers, with employees, with suppliers. Everyone has a role to play. And so the result of this work was a flyer that I'll show you in a minute. And the idea is that restaurants put this flyer at the entrance of their restaurants so that everyone's on notice from the get-go of what is required to keep people safe. We've also developed a lot of supporting guidance and FAQs and other material for the restaurant themselves as they navigate this crisis. So once we completed that work, we submitted our promise document and the underlying materials to the governor's reopening strike force. And then we were really pleased to see much of much of our recommendations incorporated into the statewide minimum health protocols for restaurants and for restaurant customers. And that was all announced with restaurants reopening at 25% on May 1. And as y'all know, that's sort of continually been updated. And so what we do as an association is we really try to stay apprised of the latest developments and make sure that we're sending that information out to our restaurants. So here's the one on the left is the first iteration of the Texas Restaurant Promise. You can see it's split up into promises the restaurant makes and then the promises we ask our customers to make to us. And then the one on the right is our most recent iteration. And so again, as you're out and about in the community, look for this promise, because it tells you that the restaurant has really gone above and beyond and is being proactive to keep you safe. So, some of the themes on here, it's really all the things Dr. Bush talked about, right? Social distancing. So all parties have to maintain 6 feet of distance at all times while they're sitting and also while they're sort of coming and going. Hand sanitizing stations have to be available. We're not using any, you won't see any condiments or menus or anything left on tables. It's all single use, provided upon request. We're also doing mandatory health screenings for all contractors and employees before they start a shift. We also have the face covering requirement, of course, as well too. So again, the idea really is just to put everyone on notice right from the beginning before you even enter the building. Here's what we've all got to do to keep each other safe. So since that was April when we developed the promise, really since then, we've been working to turn that promise into a full certification program. By May, it was very clear that this crisis was going to be long. We were going to have a slow recovery, and we really needed to help restaurants adapt to this post-COVID world. If you think about the economics for a while, restaurant dining rooms were shut for 6 weeks. They lost pretty much all of their product. That's an important thing to remember, right? A restaurant isn't like many businesses in that they can't just lock the door and turn off the lights. Our food and our product has an expiration date. So much of that was lost. Many employees were furloughed. So to tell them now you can reopen, but you need to purchase all of this hand sanitizer, you need to reduce your capacity significantly, you need to install plexiglass dividers, you need to buy all of your employees' face coverings, right? All of these things are critically important, but they also have a significant cost. And when you combine the small margins Melissa mentioned with 6 weeks of losses, that's a tough loss to bear, or a tough cost to bear. So we launched what we call the Texas Restaurant Survival Plan with 8 points to help restaurants transition and become successful in this new world. The second item of that plan was a workforce development grant to deploy high quality, low cost training to food service employees so that they can adjust to this new COVID-19 world without incurring the additional cost. And that's really where this certification program was born. So we spent really May and most of June developing this program with our partners. So speaking of our partners, we partnered with Dallas College to secure grant funding for the project and to administer the online education component. And we partnered with this company called A Closer Look to provide real-time feedback and evaluations. And we're really excited about this. We were blessed to get a $500,000 grant from the Texas Workforce Commission, and that will cover 500 restaurants being able to take advantage of this entire program for free. So what is this program? I like to think of it as kind of one big feedback loop. We have the promise, which is the foundation. It's the steps you need to take, for lack of a better word. Then we have the training to make sure that everyone understands exactly what that means and how to do it. And then we have the feedback from A Closer Look to ensure that it actually is being completed. And if there are any gaps, we've got that online training, right, to sort of reinforce the message. So how do restaurants participate in this? The first step is registration. Because of our grant funding with the Texas Workforce Commission, there is a little bit of paperwork on the front end, which we all know. It's just part of dealing with government sometimes. So there's a form, and there's going to be a link at the end of my presentation to kind of kickstart this process. So don't feel like you need that yet. So there's a form for employers to fill out. It takes about a week to get approved by the Workforce Commission. Then we move to step 2, which is really the enrollment and education piece. So we're working with Dallas College. We've already rolled out the first course. There's going to be a total of 5. And you can see they're kind of divided by audience. And so the goal is that a single restaurant will have some employee who is certified in each of these courses. So it will often be different people, right? So you'll have a supervisor complete course 1. You maybe have a waiter complete course 3, someone from the cleaning crew developing or taking course 5. And collectively, that ensures the restaurant knows what they need to do to combat COVID at every level of the operation. The great thing is, since we partnered with Dallas College, they're experts in course development. It's all online. I've actually taken the first course myself. You'll be pleased to know I passed. But it's great because it's a relatively short course. It combines video, illustrations, word text, so it's really geared for all kinds of learners. And again, it just gets into the nitty-gritty of what, when we talk about safe sanitation, what do we actually mean? Is it gloves? Is it not gloves? So it gets really into the weeds to make sure that everyone is prepared. So that's really the curriculum piece. Then we move to our partnership with A Closer Look for the evaluation and feedback. So A Closer Look, as part of our agreement, has agreed to provide multiple in-person secret inspections and customer feedback directly to the restaurant. So what's great about this is we all know the world of Yelp, of Facebook reviews, and we know how one review out of context can really just be devastating to a business, especially right now. And so what this program is designed to do is to get the restaurant the feedback they need, but to ensure they get it directly so they have a chance to actually address it and fix it if there's a problem. So what's great is this component really has 2 pieces. The secret shoppers, who have a form that they'll fill out that tracks all of the commitments in the Texas Restaurant Promise. And then it also allows customers to text in feedback directly as well. So you really get the benefit of both experiences. And these have multiple visits as well. So, if on the first try, you realize there's let's say there's an issue with social distancing, then you can come back with follow-up visits to make sure that that issue's been addressed. And finally, once a restaurant goes through these steps, they receive a certification. And that's a decal that they can prominently display to guests. And it's really about assuring your employees and your patrons that you're going above and beyond to keep everyone safe. So here is the sign up. This is what it looks like, and the link to it. It looks like Melissa also posted it. Thank you, Melissa. So we're really excited about this program. It's the first in the nation that we're aware of that goes beyond a simple kind of education program and pulls in the certification, evaluation, and feedback as well, which we think is so important. And to be able to provide this program, again, for free to 500 restaurants, it's just something we're really proud of and excited about. And again, this is all about not just dealing with the immediate crisis, but making a pivot, because we know, many aspects of our response to COVID are going to be here for at least, the medium term, right? Social distancing, sanitation. And so as restaurants, we have to adapt. And so that's exactly what what we're working on. Happy to take any questions.
Thank you so much, Kelsey. I do have some questions to ask you. So can a restaurant of any size apply for the TRA certification?
Yes.
Any size. And then are any of the programs, are they in different languages? Houston is very diverse, so we've got different cultures here.
Great question. I know that is in the works. We have translated some versions of the promise into Spanish and Vietnamese. And we're always looking to kind of expand our language options. We also borrowed, I'll say. The city of Austin did a great face covering poster. I bet Houston did too, that they translated into a dozen languages. So we're always looking for resources like that to help push out, because we know that's important.
Wonderful. And so in the East End, we created this East End Strong Facebook group page to promote restaurants and other companies here locally. We do, sadly, we know that some have closed, some are still open, some are struggling. With the new order, are there any tips that you've seen or to help during this second phase of bars closing?
Yeah, it's really tough. I've had a few really heartbreaking conversations with bar owners. I think that Melissa's advice was great about diversifying your business as much as you can. And many of the waivers and the initiatives she mentioned are things that we've spearheaded to give restaurants and bars options of how they can safely feed people and make money. I would also say it's critical to have good communication with your employees. We are the service-based industry. You don't have a product, you don't have something to sell without employees. And so the more that you can illustrate to your employees that you care about them, that you are prioritizing their health and their well-being, the more loyal that they will be to you, and the more, frankly, that they will help you combat the spread of COVID-19. When we have seen restaurants that have had to close for, a short time because they've had a COVID outbreak in their restaurant, it's almost always because employees were doing things on their social and free time and then bringing COVID back into the restaurant. And so you've really got to have that partnership and that buy-in from your employees that the things you're doing inside the restaurant, but also outside of the restaurant, have everyone's collective health and well-being in mind.
Wonderful. And this is a question for both Kelsey and Melissa. So some of the restaurants, they have, they're sharing best practices. And one of our restaurants, Henderson and Kane, it's a grocery store. And so to your point, Melissa, they're selling groceries there. And there was a farmer's market on the Navigation Esplanade, and it finally opened, but then it closed again. Are there partnerships, or have you seen partnerships, or do you encourage partnerships at restaurants with vendors like that?
So I'll answer. First of all, huge thanks to Kelsey and the team out of the state for working with the governor's office to get the waivers we needed, right? Because you can do anything and ask for forgiveness later, but you don't want to have to ask for forgiveness and pay a bunch of fines and all that stuff. So the team out of Austin with the Restaurant Association did a great job. There's no one perfect way to do it. I'd reference everyone to go to our resource page, and I put it in the comments section, in the comment section, because there's a specific thing that tells you how to be, what rules you have to follow, but it can be a great resource. If you depend on this farm or that farm or this supplier for a very special product, figure out how to maybe keep them going. I know Arnaldo Richards over on Pico's at Kirby and 59, he was doing that from day one. He may have been in a little bit of a apologize for not waiting till he had all the official rules, but because he had this one supplier that was brilliant for him, but he knew without all of his orders, it was going to be a problem. So it was a great way to lump things together. And we also, when we're talking about safety, what's more safe than having a one-stop contactless delivery of tonight and tomorrow's dinner and the groceries for the rest of the week? So, you didn't get out of your car. Our restaurants are doing masks and, everything they can. It's already a sanitary environment. It really is a great way to capitalize on one stop, get everything you need, get back in the bubble. Kelsey, what did I miss?
No, I think that's exactly right. If there's a silver lining to this horrible crisis, it's that it's shown us, I think, that we are interdependent as an industry, but also as just Texas, right? We all rely on each other to make good decisions that will help all of us. And our industry is certainly no exception to that. So partner with your grocery partners. H-E-B has been an incredible partner. We're talking to Walmart. They've been great. Our suppliers have been just amazing. Partner with your farms. I love that Melissa mentioned that, because we do have such, I don't know about y'all, but my waistline certainly has not been improved by this crisis. So we all could use a little more nutrition in our lives right now. So yeah, the partnerships and just thinking creatively, that's what's going to get us through this crisis.
Wonderful. And Dr. Bush, this is a question for you. So many households are staying home, but the husbands or one person in the family are still going out to work and to run errands. Is it truly minimizing potential exposure for the whole family?
So I think in that case we have to be responsible. We have to be very careful. So when one of us goes out, or if I go out, I am very protective of myself and the people around me. I try to be respectful. I know that not everybody before last weekend was wearing a mask. You know, it's very easy in the grocery store to run into a teenager who's still texting on their phone. You know, I take my time, and I tell my husband, take your time. If somebody's coming, you step back. You have to, there's no more rushing errands on a Saturday morning anymore. You have to take the time. You figure out when places are going to not be as busy, and go then. I mean, we all want to get out. We want some semblance of a life. When I was the first one going back to work, because my work at the hospital never stopped. I changed clothes, had hand wipes before I went inside. Take your mask off before you go inside. Don't come in, take the mask off and plop it down on the kitchen countertop. Take the masks off. If they're cloth, just, like you have a dirty clothes hamper, put the masks in there and wash them. If they're paper and you've been out and about, throw it away if you feel like you've been in contact. If we're maintaining at least 6 feet apart, the mask is icing on the cake. It is icing on the cake. But if you can't maintain that 6-foot distance, like errands, or if you need to go get some pants altered or something like that, just make sure you wash your hands, take off the mask before you go inside.
Right. So this is a question for everyone. So personally, are you primarily cooking at home, buying takeout, or buying delivery? And we'll start with you, Kelsey.
I feel like I am independently keeping our industry afloat, because I order takeout like twice a day. So we're doing a lot of takeout. We tried a new restaurant last night, which was great. Yeah, my husband and I are just working 24/7. The working from home really blurs the lines of when you're on and off the clock. And so for us, takeout has been a great way to keep our sanity and help support the local businesses that we love.
Great. You, Dr. Bush?
I started out cooking because we had to stay at home. I am over cooking. I am over preparing meals at home. And my husband can boil water. That's about it, maybe. So we have done a lot of curbside, an awful lot of curbside, and we have our rounds of restaurants. I love some of the ideas that Kelsey and Melissa said, some of the innovative ideas. I haven't heard about the getting your groceries as well. I love that. I love the one-stop shopping. So I'm going to start looking up which restaurants are participating in that. That would make my day, but it's now curbside.
Yes, Henderson and Kane, they're in the 5th Ward near the police station.
Okay.
It's a restaurant, and they have a full grocery store. So and they have a lot of local vendors, local honey, local eggs, lots of stuff.
Oh, perfect. Thank you.
Melissa.
So I have a 10-year-old at home. So some of our dining out are we've literally eaten only in as a family in one restaurant outside once since this all started. But I'm kind of with Kelsey. My husband and I early on sort of figured out what our dining out budget usually was in any given time. And since he's working at home and not eating lunch out, and same for myself, we have used that. And I will say we do it a couple of different ways. We kind of go high-low. So we've probably done a little bit more pizza and drive-through chicken sandwiches and stuff. But then we go the other side, and I've done some really, we have treated ourselves to a nice boozy prime rib, and we've done some things with some different chefs that we wouldn't usually get to participate in, or that we've just been missing, like Brennan's. So we're thoughtful about it. So we do cook a lot, just because I've got 3 people at home trying to eat 3 meals a day, and you got to feed the kids. I promise you, they come get you if you don't feed those kids. But yeah, we definitely, I would say that food coming into our house prepared by somebody else has increased over this time. And it's just food boredom. We're very, very privileged to be able to afford to dine out or to, bring food in from outside. And they're just so tired of my tacos and spaghetti and everything else. So.
Wonderful. Thank you so much for sharing that. My husband and I did go to El Tiempo on Navigation last night for dinner, and they have, one way in, they clean the doors. They were just so safe and sanitized, and the tables were just distanced, and the service was just extra special. So I know a lot of folks are needing our help, and this is the time to help those. So in closing remarks, Kelsey, anything that you want to close with, either words of encouragement or how to reach you?
Yeah, my email address is in my little name label. So please feel free to reach out if you have questions. My closing thoughts are, there's so much unknown right now. And the best that any of us can do is just put one foot in front of the other. As Melissa said, ask for help, look for help, and be gracious to each other. If you do go to a restaurant or get takeout and you see something that concerns you, talk to the manager about it, and explain your concern rather than sort of venting on social media or that sort of thing. We are all dealing with so many new things that we never thought we were going to have to deal with. And so let's work together on it. Let's be collaborative, and let's show each other grace, and let's stick together, because that's how we're, like I said, innovation and collaboration is what's going to get us through this crisis.
Beautiful. And Dr. Bush, any closing remarks?
Not really. I thank you for this opportunity. I thank the restaurant industry for, yes, adding a few inches to my waistline. I just remind everyone that the practices we have to do, it's not for forever. And again, it's not political. It's about health. It's about keeping you and your loved ones and the public healthy. Thank you.
Great. Well said. And Melissa, your closing remarks? You're on mute. Yeah.
One thing I wanted to say thank you to you, Francis, because I think so often we as a community feel very personally touched by the restaurants. They are part of our fabric. They are where we celebrate. They're where we, we nurse a broken heart, all those good things. And so often we're seeing that the restaurants are, oh, this one had to close because of COVID or whatever. And what we're not recognizing or remembering is that restaurants have always been safe and sanitized. We work very, very hard. The chance, it's not a foodborne ailment. We are doing everything we can because we need our patrons to be safe. And that's always been our issue. We always want you to be safe. And so just because you're hearing a lot of stories about restaurants or whatever, that's just because it's clickbait. Honestly, I hate to, but it really is. We're not having to get an update on every Home Depot employee that had COVID or anything like that. So don't fall for that. Restaurants are working really, really hard to maintain their safety, to maintain their trust. We are so appreciative of everybody who keeps supporting us, who's dining out. Have some grace, like Kelsey said, please, please, please. This will end. We don't know when. I'm not going to set a false line because then it's just disappointing when we don't hit it. But this will end. We're going to be stronger and more interesting on the backside, but only if we do the work right now to make it to the other side. And I'm so excited when we get to the other side. you and I'll sit down at El Tiempo and we'll have some margaritas and chips and green sauce, and it will be a glorious day.
And we'll invite Dr. Bush and Kelsey
Absolutely.
too. Kelsey, we'll do you remotely. We'll do it in a Zoom meeting.
Okay, I'll drive over. We'll drive for margaritas.
That's
right.
Good. Well, thank you all so very much. And again, we have an East End Strong Facebook group page for anyone watching. If you have a restaurant that you want us to support, please share one of their a meal from their site, and any other way that we can help you. Together, we'll get through this. And we appreciate everything. So go to our website after this and find past business webinars, including this one. Have a wonderful day, rest of the week, and we'll see you guys later.
Bye. Thank you.
Bye. Thank you.